My name is Heather. I'm a family nurse practitioner here at the primary care office, and I'm going to ask you a few questions and collect a full health history on you today. Is
Great.
that okay?
Yes.
Okay, may I just confirm your full name and date of birth?
Sure, it's Matthew Simpson, and it's 9/7/71.
Okay, and what would you like to be called?
Matthew, Matt.
Matt's okay?
Yeah.
All right, so I'll call you Matt. So, Matt, tell me why you're here today.
Well, I don't go to the doctor that often. Probably should start going more as I've gotten a bit older. But lately, I've been having some pains, mainly in my legs, and it's hard to describe because fortunately, spent most of my life where I've been pretty healthy. But lately, I've been having these pains in my legs, kind of in my shins and in my knee, and it's like a throbbing pain, but it like pulses, it comes and goes. And then sometimes it's almost like tingly. Like I get like almost like like if your leg fell asleep or something, but it's weird because it's like in my shins or in my knees, and then I'm also getting some throbbing pain in the shoulders and back, but just like kind of aches and pains, but the ones in the legs feel a little different. So I figured I'd come in and check it out.
So, Matt, when did these pains start?
I don't know, 4 days ago, I guess.
Okay, so 3 or 4 days ago.
Yeah.
And as of right now, on a pain scale from 0 to 10, 0 being the least amount of pain, no pain, to 10 being the worst pain, where do you fall in that right now?
Yeah, not too bad right now. I'd probably say like a 3.
Out of 3?
Yeah.
When it's at its worst, what is it?
I mean, it's probably, maybe at its worst, a 5. Like it's probably more a discomfort than a pain, or just that I could feel something's off versus like it hurts,
And you said it's throbbing.
Sometimes it tingles.
And it radiates up your
on occasion
leg. So does it start at your ankle? And
no, it's mostly been like the shins and the knee. Then like sometimes when I'm walking like upstairs or whatever, that's when it'll be a little bit more painful. Maybe that gets to like a 6 or a 7.
Okay.
But mostly if I'm sitting down, I sit at a desk all day. I don't have great posture, and then I have stress. So I think it's like as I'm sitting, I'll just feel this like almost like this discomfort, like a restless leg syndrome type of thing, where it's like I feel something there. It doesn't really hurt, but it doesn't feel right. If that makes sense.
It does. Anything that makes it feel better?
Not just kind of goes away. Sometimes I'll rub it. Sometimes I'll like flex, or bounce my knee a lot, like get movement going. But no, it just kind of comes and goes.
Is there anything that makes it worse?
No, it's pretty even.
Do you take any medication or do any other therapies for it?
No, this is
as far
new.
as like heat,
No, on occasion I took
elevation.
I didn't think about the elevation thing. No, I've taken some Aleve on occasion.
Does that make it feel better?
I think so. Again, it's not really like a pain that I could say, oh, like when I have a headache, I take an aspirin or an Aleve, my headache goes away. This has just been something the last 3-4 days. It's just kind of been there.
Okay.
Yeah.
Okay. So that describes that. Is there anything else that's bothering you today?
Not today,
no.
The
pain in your legs?
No.
Okay. Can you tell me a little bit? I'm going to ask you some questions about your past medical history.
Sure.
Can you just explain to me if there is anything else that's been going on?
Yeah. So again, like I said, I didn't go to the doctor that often, but as I've gotten older, I have. And they did my blood work last round. They found I had a little bit of a little high cholesterol.
Okay.
Like I guess as he put it, it's the low end of high cholesterol. So they put me on a 20 milligram of atorvastatin for that. And then they also tell me I'm pre-diabetic.
You're pre-diabetic.
Which they found interesting because I'm not, overweight. I'm overweight for my height, but not like obese.
Okay.
So they think it's probably my more diet, and I do eat a lot of sweets and such. So.
Anything in addition to the elevated cholesterol and pre-diabetes?
No.
And other than the atorvastatin, is there anything else that you're doing to manage that?
Yeah, I take, this stuff called berberine gluco gold or something. I try to take that to help with my blood sugar, but also, trying to change my diet, right? Like trying to eat less sugary foods, less carbs, which is hard because I love my carbs. But I'm trying.
Good.
Yeah.
Any surgical history? Have you had any surgeries in the past?
No.
Okay. Have you ever had a colonoscopy?
Yes.
Okay. When
I
was
did.
your last colonoscopy?
This year was my first. Not this year, so we're 2024 now. So it was last 2023, and I want to say I think it was like May or June.
May or June?
Yeah,
Okay.
I
So
think.
of 2023.
Yeah.
Okay, good.
And it came back clean. I had no polyps or anything, and so.
Did they say when you have to go back?
Yeah, it's 10 years I think now.
Okay, good.
Yeah.
I'm glad that you went.
Yeah.
And you were mentioning your medication, so we
Mhm.
have you on the atorvastatin 20 milligrams that you take
Yeah.
at nighttime.
At night, about 10
Okay.
o'clock, 11 o'clock.
You're taking the berberine gold. Is that daily?
Supposed to be.
Is that how many do you take?
You're supposed to take it with every meal.
With every meal.
I don't do that, because I don't eat, like, I don't have a meal at breakfast all the time. Sometimes it's like a bar or, lunch. So I'll just have it usually with my bigger meals.
Okay, so you do it once a day. Do you
Once
do
or
one or
twice.
2 tablets?
One tablet.
Do you know how many milligrams that is?
I don't.
That's okay. We can look that up.
Yeah.
And then anything in addition? Do you take any multivitamins?
I do. I take Centrum 50 plus silver. I'm 53, so.
Okay.
Yeah.
You take that every
Am I
day?
53 or am I 50? I'm 53 now.
Take that every day?
I do.
Okay,
Yeah.
so that's good. And then in addition to that, do you take any over-the-counter medications like painkillers or anything else that
Only
you,
if I feel pain.
as needed?
Yeah, as needed.
And as far as your prescribed medications, it's only the atorvastatin.
That's it.
Okay, very good. And allergies?
In the fall, I'll get like sneezing. It seems like when the leaves are changing, sometimes or in the cold morning, but nothing like, oh, you've been diagnosed with this. Like no food allergies, no medication allergies.
Okay, so no food or medication.
No.
For your seasonal, do you take anything to relieve
On
that?
occasion, I'll take a Claritin if it's really bad.
Okay.
Yeah.
Do you feel like you need to take that multiple times
No.
a week, or it's just
Oh, I think
as
a day.
as needed?
As needed. Yeah,
Okay.
but a lot of times it'll be like once, maybe twice a week. But my allergies are mild.
Okay, well that's good.
Yeah.
And then as far as family history, is there any cancer history with your
My dad had
family?
cancer. They believe it was some form of cancer. It was near his pancreas, but they wouldn't say it was pancreatic cancer. But he had some form in one of the tubes down there near the pancreas. He had some cancer. But that was about it. My grandfather had a heart issue. It might have been cholesterol related, but nothing like major within the family.
Nothing major cancer wise.
No.
What about hypertension? Anyone have like any issues with like their blood pressure
Oh,
or
I would imagine
anything
my
that?
dad did. Yeah, but he didn't.
Yeah.
They didn't really discuss that. It was a different time. Didn't tell you all that stuff. But I could probably ask my sister to find that out. But he probably had high blood pressure, I would think.
You have just how many siblings? Do
I
you
have one sister, and both my parents have passed away.
Oh, okay. I'm sorry to hear that.
Thank you.
And then for your sister, how is her health overall?
Overall, it's good. I think she's a bit older now. I think she's going through menopause,
Okay.
which makes it fun to deal with. Yeah, I think overall pretty good. She same type of thing, doesn't really have any major health issues. So
And you say both your parents have passed.
yes,
Your dad from cancer. You think, and then your mother.
she was diagnosed with acute pneumonia. That was the cause of death. My parents did not go to the doctors regularly, so you could kind of see where that comes from. And she was sick with pneumonia, didn't want to go in, went in, and then I guess it was just too much fluid in her lungs. But neither of my parents were very healthy people. They both smoked a lot, and they both drank.
Okay.
Yeah.
And that actually leads to my next question. So I'm asking some social questions
Sure.
for you. Do you smoke or no smoking? Have you
Never
ever?
smoked anything in my life.
Okay, that's good.
Never smoked cigarettes, cigars, pot, nothing.
Okay, so
Never.
have you ever done any kind of recreational drugs or even tried it?
Nope.
What about alcohol?
I didn't drink until I was out of college.
Mm-hmm.
Didn't even drink through high school, through college. I mean, I might have had a sip here or there. Then when I got out of college, it was like a 2-3 year period where I was drinking, but now I really don't drink anymore.
Okay.
So I'd say social drink now on occasion. I'll go out, with the wife to dinner, maybe have a drink at dinner on occasion. If I go out with some friends, I might have a drink, but not always.
That's good.
Yeah.
So you would say like in a week span, maybe 1 or 2 or none at all.
In a week,
Yeah.
I'd say on average 0.
Oh,
It's more special occasion type things.
That's really good.
Yeah.
And then as far as your employment,
Right now I'm currently freelancing. I got
okay.
let go from my last job 2 weeks before Christmas. So I'm creative director in a marketing advertising agency, or field, I should say. And I got let go 2 weeks before Christmas. So right now I'm freelancing.
Is that an active job? Are you walking around a lot?
No.
Or is it more of a sedentary position where you're sitting at the desk?
Sitting at my computer. I mean, I get up quite a bit throughout the day, but it's not like I'm doing road work, where it's active like that.
So you can find yourself sitting there for
hour stretch.
4 to 6 hours before you stand up?
No, I'll get up. If I work an 8-hour day, I'll probably get up once every hour or so.
Okay.
If not more.
And then as far as like your just exercise activities and things that you do throughout the week, can you tell me a little bit about how?
Don't do a lot.
Okay.
When the weather gets nicer, I'll probably get back to I'll do, running. Right now, every day I'll take my dog for a walk.
Oh, that's
usually
good.
Twice a day. And that's probably about 2 miles on average. That's every day. So I do walk at least 2 miles every day, but as far as going to the gym or lifting or exercise or any of that, stretching no, I'm not very, very active or healthy in that.
Well, the walks are good, so
Yeah,
that's definitely something.
Yeah.
You mentioned you're married.
I am.
And as far as I know, this is not always easy. You don't have to answer, but sexual history. Are you sexually active?
Yes, probably not as much as we should be. But
are you married to male, female? Okay. And do you wear protection when you have sex? Okay.
Yeah.
Is she on contraception?
No, she's not. She recently had an IUD put in, I think it's called.
That's birth control.
Birth control. All right, so yes, she is now. But
Okay.
that was recent.
Okay.
But until then, no, we would just make sure, we weren't.
Any children?
No children.
Okay.
No children.
And then as far as your overall health, so I'm just going to we're going to do basically a review of systems, basically head to toe.
Mm-hmm.
And I'm just going to ask you questions and just make sure everything is okay. Okay. So your skin, is there anything bothering you on your skin?
No.
Do you have a dermatologist? Do you get your moles looked at? Is there anything that looks, out of borders or rashes or anything that's bothering you on your skin?
No.
Okay.
I've had them all checked a couple times and it hasn't really gotten bigger, so kind of neglected it the last couple of years, but it's on my shoulder.
It's on your shoulder.
Yeah.
Okay, so that might be something to look at.
I'll look at it again, yeah.
Absolutely.
Yeah.
And for your eyes, do you wear glasses?
So I have trouble seeing distances, so I'm nearsighted, and I basically use them at night.
Okay. And
driving, night watching television.
do you go to the eye doctor every year?
I do.
Okay, and you feel like your prescription is working? You feel that you're
Yeah,
able
in
to see
fact,
better?
so in 2022 I went, they gave me a new prescription because it had been probably a couple of years since I'd gone. So in 2022 I went, and then I went again in 2023, and they're like, your prescription really hasn't changed that much, so we didn't even get new glasses.
Okay, good.
Kind of the same. But I do work at a computer. I'm on screens a lot. So, my eyes definitely have gotten weaker.
Absolutely.
Yeah.
And then as far as your ears, how is your hearing?
Well, I think it's what I like to call selective. But no, overall it's good.
Any issues with pain or discomfort with your ears?
No, they get waxy on occasion.
Okay.
You know.
You're able to clean them okay? Not
Yeah.
an issue with that.
No.
How about your...
I had frozen shoulder.
Okay.
Had that in 2021. And then my theory was it was from COVID vaccine, because I talked to a few other people, the same thing had happened to them. And I now have my range back that I could do this,
Oh, that's great.
but I still can't reach all the way around my back. With this arm, I could reach all the way around and touch up in between my shoulder blades. With this one, I could only go about that high.
How long did that take to resolve?
Well, this still isn't resolved, but to go up, it was probably over a year.
The pain and the discomfort, has that dissipated?
Yeah.
Okay, that's good.
Yeah.
So are you still doing the exercises
No.
to... Okay.
No.
Did they give you exercises, the physical therapist?
Yeah.
Okay, it's something to think about for the future if you ever
Yeah.
want to get that range of motion back.
It
But,
is.
you know, we can talk about that. How about your breathing? How's everything going with your nose? Any congestion?
No, I
any-
mean, I snore.
Okay.
If I'm laying on my back, I'll snore.
Every night?
Seemingly, that's when my wife usually hits me
Okay.
every night. So I think, you know, it was worse at one point. I don't think it's as bad now, but
Do you feel like there are certain times of the year that it's worse than other times?
I really couldn't tell you. I'm asleep.
Okay. And do you have any other sinus issues or anything like that?
Only
Congestion?
Only when I have a cold or whatever, yeah.
Okay. And how are your lungs? Any history of asthma or difficulty breathing, shortness of breath?
No.
Okay. So that's all good. How
Yeah.
about your mouth?
How
Do you
about
have
it?
any issues with your teeth? Any issues with your
Oh,
gums?
my teeth, almost all of my teeth are filled.
Okay.
You know, again, go back to my sweets. You know, growing up, I ate a lot of candy, and but I also think it's a family history thing. I don't think my family has very strong teeth.
Okay.
So I'm missing a tooth back here. It was pulled and never put a crown in on the bottom, and then I have a crown on the top on the right side. But my teeth aren't great, but they're, you know, I haven't lost any more. So
How about any difficulty swallowing? Anything? Any sore throats or anything like that bothering you?
No.
Okay, very good. As far as your stomach, how do you feel? Do you have any
it's gotten bigger.
constipation? Do you have any issues with diarrhea? Do you have
It all depends on what I eat.
okay,
Right? So not regularly. I don't
bloating,
have like.
discomfort?
Yeah,
Things
it
like
just
that?
depends on what I eat, right?
Okay.
I don't eat healthy. I don't eat I eat like my wife would say, a 12-year-old, 14-year-old. I like pizza and cheeseburgers and hot dogs and, you know, nothing that is good for you. Carbs, pasta, meats, you know.
Right.
So depending on what I eat, it'll affect my, you know, I'll get gassy, or like if I eat vegetables, ironically enough, I get very gassy.
Well, that's very
So,
common too.
yeah. But no, I don't have, you know, problems digesting. I don't have a noisy stomach, you know.
And no bloating or any issues.
I mean, on occasion I have bloating,
discomfort.
but nothing regular now.
Or like any kind of gastroesophageal reflux or heartburn, anything like that.
Have I had heartburn in my life? Yes, but do I get it regularly? No.
Okay. Well, that's good. And how about your heart? Do you have any palpitations? Do you
No.
have any issues other than
When I've had the EKGs done, they said it's been great.
everything's been normal?
Yeah,
Blood pressure is normal.
normal.
And we'll do your vitals today.
Yes.
As far as your urinary tract system,
Yeah.
how is your urine able to stir?
I got a strong,
You have
I
a
got a
good
strong
stream.
stream.
Good
Strong
stream.
stream. I've been asked that, so yes.
Okay, good.
Yeah.
And any pain or discomfort when
No.
you're urinating? And then is the color okay?
Yeah, I'll, you know, fluctuates depending on how much.
Nice, like yellow.
Yeah.
Okay. All right. Well, that's good to know. Moving forwards, I know you told me about your pains. It was really just the shoulder, and then also you were telling me about the pains that are in your shins. Is there anything else?
Knee. Mostly my legs, you know. So I carry a lot of stress and tension in my neck and shoulder area.
Mm-hmm.
So it'll feel a knot up, you know, up in here. So I'll sometimes get stress headaches. My last job, in fact, was very stressful, and I looked it up on the internet, so I'm self-diagnosing myself, but it was new to me, completely new. And it was a what they called an ocular migraine. So in one eye, my left eye, I was seeing spots and I couldn't focus. So I Googled it, and that said you're probably experiencing a ocular migraine. It'll go away 15-20 minutes. And, I just laid down, closed my eyes, and it did. It went away. Of course, at the end of that, it said, or you could be experiencing the beginnings of a stroke, which, thankfully I wasn't. But, so that was new. So stress does affect me, is the point I'm driving at here. And I do carry it in my neck and shoulders.
Do you ever get any swelling in your legs?
No, I don't think so. I mean, earlier today I had noticed there was like sock lines there.
Okay.
But I was also eating salty food. So again, I don't eat healthy enough.
How is the hair on your legs? Do you feel like you still have the same amount of hair you always have had, or have you lost any hair on your legs?
No, I think it's about the same.
Okay.
Decently hairy legs.
And then do you bruise easily?
No.
Okay, do you have any intolerances to heat or cold?
I mean, I don't like being hot, but I don't like being sweaty, and then summer or humidity, I hate all that, but I don't know.
It just doesn't happen, you don't understand to sit there and you're overheating for
in
no reason, that it's not
no,
100 degrees outside.
No.
It's nothing abnormal. On a hot day you're hot, you don't like it.
In general, I'd probably say I run a little on the warm side.
Okay.
Warm Italian.
But there isn't any major concern there.
No.
Do you have any numbness or tingling in your fingers and toes?
On occasion.
Okay.
On occasion.
Fingers and toes, or just one or the other?
One or the other. It's never at the same time. So
but they happen. And
sometimes I'll be like, oh, I'll feel a little bit in my fingers, and then it'll go away. And then sometimes I'm like, oh, why is my toe, why are my toes feeling that? And it might be after I've been sitting at the computer for a while or whatever. But nothing where it's the same time. Are you ever doing an activity when you're feeling it? Are your legs crossed when your legs? Oh, my legs are crossed.
When you're feeling the toes tingling, and are you engaged in
gaming?
Or
I do play a lot of
some
video
sort
games.
of computer activity or something like that, where you're using your fingers a lot before that happens, or is it just?
No, it's more just random, or when I'm not using them. So if they're sitting still for a while, or definitely if I'm laying down and my legs are crossed, I'll feel it then, in my toes. Or if I'm sitting for too long in the same position, my leg will fall asleep, or my legs are crossed, it'll do that. But yeah, nothing, just random.
Any issues with your wrists?
No.
Okay, so nothing with tendinitis or anything.
No.
As far as your, do you have any anxiety, depression?
Definitely have depression. Getting old, but then losing my job again. I was at one agency for a long time, and then 17 years, and then I got let go. Kind of went through it, trying to find another job, 6 months or so. And then, got another job. Was doing well there for a couple of years, then just lost that again. So I think there's definitely a little bit of depression.
How do you manage that?
I distract myself on movies, video games, sometimes retail therapy.
Does that help?
It does. It's not like a constant malaise. It's just at times. Sometimes when I'm left to my own devices, or if I'm just kind of sitting in the quiet, my mind will go, and it's all part of, I think for me, just getting older and taking inventory, as they would say.
Okay. And then do you have an active social life? Do you have support?
I do. Yeah,
okay.
I do.
And are those friends, family members?
All of the above.
Okay. So you feel good talking to people about
Sure.
how you're feeling?
I was going to a therapist, but she ghosted me. So
okay.
I was going to her for a long time.
How many years were you seeing her?
I started in 06, maybe 14, 15.
It's a long time.
It is. And on and off, was never a set time, but, there was spells where it would be every week, and then there was times it'd be once a month, and there was times it would, but then, with insurance and everything, I think there was just a miscommunication, and she just stopped texting, and because my insurance was no longer covered her, and even though we'd worked out a payment plan, yada yada yada, just kind of fell off.
And how long ago was that?
Started in 2021.
Okay.
Yeah.
So kind of a while.
Was it 2021?
Back.
We're in 2024 now, so 2022. I'm sorry, 2022 is the last time I probably spoke with her, at the beginning of 2022.
Okay.
Like February of 2022.
Yeah. Do you think that's something that you might want to
I don't know.
think about again?
We'll see.
Okay.
We'll see.
Well, just to kind of summarize everything.
Yeah.
So we are here today because you are experiencing almost like a numbness, tingling, discomfort in your shins.
In my legs.
In your legs.
Sometimes it's very concentrated in my shins, and I know it sounds weird, but
Yeah.
it is. And then I'll feel like a throbbing pain in my knee, or I'll feel, yeah.
You have elevated cholesterol,
I do. Slightly elevated.
pre-diabetic,
I am.
and then we have a little bit of depression.
Yes.
Okay, so that's great. We are going to go ahead and we have this in our system.
Right.
We're also going to do your head to toe exam today, and then do your vitals
Blood
and
pressure and all that.
see how you're doing.
Great.
All right, thank you for all the information.
Thank you.